Which of the following spinal fracture types is the most stable fracture? A. Teardrop fracture. B. Burst fracture. C. Unilateral facet dislocation. D. Hangman's fracture. E. Clay shoveller's fracture. And the answer is E. Clay shoveller's fracture. Regarding teardrop fracture of cervical spine, it is referred to any fracture with a triangular fragment in the involved body. It can be divided into two types based on mechanism of injury, extension or flexion type of injury. The most common is a flexion type injury. This illustration shows a teardrop fracture with a triangular fragment of the involved body. For hyperextension type injury of teardrop fracture, it is commonly a cervical teardrop fracture of C2 vertebral body. Anterior longitudinal ligament originates from the base of C2 D axis. In cases of extension injury, the avulsion fracture occurs at the bottom of the anterior-inferior side of the vertebral body. The stability of the posterior side is maintained. For flexion type of teardrop fracture, the most characteristic features are posterior displacement of the upper column of the divided cervical spine. Other radiographic characteristics include backward displacement of the posterior fragment of the involved body, widening of the interlamina and interspinal spaces, widening of the facet joint with backward displacement of the inferior facet, kyphotic deformity of the cervical spine at the level of the injury, frequently associated with sagittal body and laminar fracture, predominantly at the level of C5. This CT scan shows a flexion type of teardrop fracture with backward displacement of the posterior fragment of the involved body. Next, regarding the burst fracture. The most common site of injury to the spine is the thoracolumbar junction, which is the mechanical transition junction between the rigid thoracic and the more flexible lumbar spine. High-energy traumatic vertebral fracture caused by flexion of the spine that leads to a compression force through the anterior and middle column of the vertebrae. There are different classification systems for burst fracture. We are talking about thoracolumbar. Denis, 1983, described a three-column classification of spinal fracture. He proposed that injury to the middle column, that is the posterior portion of the vertebral body, posterior longitudinal ligament PLL, and posterior disc was sufficient to create instability. He also classified unstable fracture into three types: mechanical, first degree, neurological, second degree, or combined mechanical and neurological, third degree. Afee et al. 1994 described another classification. He classified the injuries based on how the middle column failed, with burst fracture showing middle column failure in compression. He also distinguished between the burst fracture with or without PLC, posterior longitudinal complex disruption. continue from Afee et al., a burst fracture of the PLC disruption is considered to be unstable. Posterior ligaments have probably failed if there is more than 30 degrees of kyphosis and or 50 degrees of vertebral body height loss on a plain X-ray. To confirm PLC disruption, suggest for MRI. This picture shows a CT scan that reveals a burst fracture that involved the middle column with a bony retroportion to the spinal canal. Next, regarding a unilateral facet dislocation, the mechanism of injury is due to flexion and rotation. It is always associated with monoradiculopathy that improve with traction. Radiographic findings: 1. Subluxation of the affected level with 25% translation, that is anteroposition of 25% of the epidiameter of the vertebral body. 2. Malalignment of the spinous process is seen on AP view, which can only be produced by a rotatory injury. The involved spinous process points to the involved site. This X-ray illustrated the unilateral facet dislocation of C4, C5 level. From AP view, there is a malalignment of the spinous process. From the lateral view, there is a 25% translation or anteroposition of 25% of the epidiameter of the vertebral body. Regarding Hangman's fracture, it is a traumatic spondylolisthesis of the axis. It is described as bilateral fracture traversing the pars interarticularis of C2 with an associated traumatic subluxation of C2 on C3. The most commonly used classification of this fracture is Levine and Edwards classification. It is almost always stable without needing surgical intervention. This X-ray of cervical spine shows a traumatic subluxation of C2 over C3. Lastly, regarding Clay-Chauvel's fracture, it is an avulsion-type spinous process fracture in the lower cervical or upper thoracic spine. It is commonly at the spinous process of C7 and T1 vertebrae that are affected. Diagnosis is made with lateral radiograph of the spine. The treatment is usually rest and pain control as the injuries are mechanically stable. This X-ray shows a undisplaced of C6 spinous process fracture and displaced fracture of C7 spinous process. So this answer our question. The most stable among the fracture is Clay-Chauvel's fracture. So another summary. In summary, unstable fracture of the cervical spine involve 1. Flexion type injury. Example in bilateral facet dislocation, flexion teardrop fracture, wedge fracture with posterior ligamentous rupture. Number 2, the extension type involving an odontoid fracture type 2. Another example of extension type is Hangman's fracture, extension teardrop fracture. 3. Vertical compression. Example is burst fracture that involved in the cervical spine is example Jefferson fracture. Okay, thank you.